Gaming addiction classified as mental health condition. Update: the World Health Organization has now officially added gaming addiction to its 11th International Compendium of Diseases. On Monday, June 18, WHO confirmed that gaming disorder has been added to its section on addictive disorders. The ICD was last published in 1992, and the new version of the guide contains other major revisions. ICD-11 will be presented at the World Health Assembly in May 2019, where its member states will vote on adoption. A Department of Health and Social Care spokesperson told Eurogamer that it welcomes the news, saying, "Very large numbers of people play games on and offline. For the vast majority it is a recreational activity. But research shows that for a small number their gaming can become harmful, or an addiction." We welcome the inclusion of gaming disorder in ICD-11, which will over time help to understand the true prevalence of harmful gaming. The topic of gaming addiction has sparked intense debate in recent months, with much discussion angled around the popularity of games such as Fortnite, Battle Royale. Piers Morgan even got involved during a Good Morning Britain debate on gaming addiction earlier this month. But the WHO decision has been met with criticism by a number of gaming organizations around the world. Video games across all kinds of genres, devices and platforms are enjoyed safely and sensibly by more than 2 billion people worldwide, with the educational, therapeutic, and recreational value of games being well-founded and widely recognized. UKI, ASA, EGDF, IASA, ASAC, IGEA, ssified Games and UBVNG said in a joint statement. We are therefore concerned to see gaming disorder still contained in the latest version of the WHO's ICD-11 despite significant opposition from the medical and scientific community. The evidence for its inclusion remains highly contested and inconclusive. We hope that the WHO will reconsider the mounting evidence put before them before proposing inclusion of gaming disorder in the final version of ICD-11 to be endorsed next year. We understand that our industry and supporters around the world will continue raising their voices in opposition to this move and urge the WHO to avoid taking steps that would have unjustified implications for national health systems across the world. Original story: the World Health Organization has confirmed that it is classifying gaming addiction as an official condition. The 2018 edition of the International Compendium of Diseases will list gaming disorder as a significant problem, following a huge rise in the popularity of video games since the last ICD was published in 1992. A draft version refers to gaming behavior that takes precedence over other life interests, suggesting such behavior should usually continue for at least 12 months before a diagnosis of gaming disorder is made. Speaking to the BBC, Dr. Richard Graham, lead technology addiction specialist at the Nightingale Hospital in London, welcomed the findings. Related, snooker star Neil Robertson damaged his career with video game addiction. It is significant because it creates the opportunity for more specialized services, Dr. Graham, who sees around 50 new cases of gaming addiction each year, said. It puts it on the map as something to take seriously. In contrast to commonly voiced fears that children are becoming increasingly addicted to gaming, a recent study by the University of Oxford suggested that although modern kids spend a lot more time glued to their screens, they don't do this to the exclusion of other activities, instead spreading their digital tech use throughout the day, while doing other things. But when do gamers know that they have crossed the line between casual Crash Bandicoot and full-blown Mario madness? In South Korea, steps have already been made to prevent gaming-related problems, with children under the age of 16 being banned from online games between midnight and 6 a.m. The argument over gaming addiction has raged for decades, and the WHO's update is only going to make the issue more of a talking point. However, in a year that featured superb, innovative titles like The Legend of Zelda, Breath of the Wild, the debate is unlikely to harm an industry as big as gaming. Want up-to-the-minute entertainment news and features? Just hit like on our Digital Spy Facebook page and follow on our @DigitalSpy Twitter account and you're all set.